My name is Ashley Herndobler. I'm 20 years old and I'm a PTA student at University of Indianapolis. I one night just noticed that I had a bump right here, probably about the size of a golf ball. So I went to the UIndy Health Clinic, which is associated with Community Network. And the nurse practitioner there had noticed the lump right away. So she wanted me to set up a meeting with Dr. Lee as soon as possible.
At that point, I kind of outlined what I thought were reasonable steps, including some blood tests, chest x-ray to look at.
They told me that it was Hodgkin's lymphoma. It wasn't a complete surprise, but I was still pretty shocked.
When I first met her, all we had was a biopsy. Really didn't know anything else except for the fact that she had Hodgkin lymphoma. We talked about various different ways to treat this, but we did ultimately decide on chemotherapy.
My boyfriend's name is Charlie Kidd, and he played a huge role in going through chemo with me.
So every 2 weeks she had their treatments. And unfortunately I get there right after they gave her the Benadryl, so she was pretty tired. Most of the time she'd stay awake until I get there, give her a hug and a kiss, and then she just napped.
Cassie, my navigator nurse, was a big help in figuring out where to go, how to get the whole plan set up, and also informed us about a Livestrong grant. So it was pretty much almost all covered.
This says Ashley Strong, and it's got a Bible verse, which is Romans 8:18. That's a verse in which the Apostle Paul is writing to the church at Rome, and he's telling the Roman Christians that no matter how difficult they may perceive their current struggles, that there is hope, there is a life beyond their current struggles, and I just thought how appropriate that was that Ashley would choose that.
So Cassie, she'd asked if I had gotten my voucher yet. And so she went and talked to the social worker, and she came back with a $250 Walmart gift card, and I was just blown away. I couldn't even explain to her how thankful I was. It was just nice to be able to take a little bit off my parents' plate just because they were already going through a hard time.
When patients qualify for the voucher program, they are given a voucher that they can use pretty much in any way they want. And her family lived far away. She was enrolled in school, so the vouchers were very important to her and her family to be there for her.
Those are all possible because of all of our past giving gigs.
Every Wednesday evening before treatment, we would stay in a hotel just because my chemo appointments were pretty early and it's a 3-hour drive.
When we first met and we talked about this, there was unfortunately tears of sadness, but it was quite the opposite this last time we met.
I don't know, I think it was just from my expectations. I thought he was just gonna walk in the room and say, "You're in remission," and he didn't, so that made me a little worried.
We talked about complete remission. It was complete tears of joy.
I'm officially in remission. I feel like a different person, I guess, now, and I feel like my nurses and doctors played a huge role on influencing me, even the front staff people, everybody. I want to go into the medical field, and I have them to look to as role models now.
Not only did she have family and friends with her, but the staff at Community Health Network is taking care of her.
Definitely recommend Community Health Network to anyone I know.
If she hadn't had parents, I would have been adopting her. She's just an incredible young lady. She's everybody's friend, and everybody feels the love that she gives in return.
1, 2. I just want to say thank you for all your help and support, and just continue to help and support people like me because it really means a lot.